good evening, and welcome to Community Immunity. This is our series of programming that we are going to be focusing on some specific regions of the country that have been either behind, particularly those areas of the country that have been behind in terms of getting vaccinations done. And so we want to go into those areas. We want to talk to people directly from those areas and find out what's going on, find out what the hesitancy is in those areas, and really find out what the conversations are like and about. So tonight we are focusing on Alabama. So we're going to be right there in the middle of the Dirty South, and Alabama is tonight's subject. So we've got a wide variety of guests for us this evening. We've got a national expert, so Dr. Toyin, who has been with us from the beginning, so we're happy to have her. We've got some local citizens. We've got Bishop Lowe that's going to be coming in, and if y'all remember him before, you'll remember him. Bishop Lowe is a wonderful, wonderful man, and he's been here before, so we're going to talk about his story. We've got some pioneers, and we're going to save that story for you. We got a pioneer with us here this evening. And we also have Dr. Martha Dawson, who is Alabama right there, lives in Alabama, and she is also the president of the National Black Nurses Association. So we definitely want to talk to her about what's going on not only in Alabama, but with nurses across the nation. So that is tonight's lineup. So we are here to really, really get started. So we're going to get started with, I'm going to talk about some of the statistics and why we chose Alabama for this production tonight. So in terms of the nationwide statistics, total 63.7% of adults in the country have had at least one dose of a vaccination. 42.1% are fully vaccinated. So that is across the nation, everybody, put into one bucket. But when you pull Alabama out, that number of people having at least one vaccine, that drops down to 36.2% of people living in the state of Alabama has had at least one vaccine. 29.4% are fully vaccinated, and 20.88% of that people that have been vaccinated are Black. So what does this mean to the people in the state of Alabama? This means that 1 out of every 3 people in Alabama are vaccinated. So if you are in a room, if you're in an elevator with 2 other people, that means 2 of y'all aren't vaccinated. And then when you take that out, you make that only Black people, that means you could be in the elevator with 5 people and 4 of them are not going to be vaccinated. And so that is really, really challenging when it comes to staying safe, because we understand that not only when people are getting sick, when people are getting ill and catching COVID, that the outcomes for Black and brown people have been harder hit on the other end of that. We experience more symptoms, we experience tougher outcomes, and we have a higher death rate and toll when it comes to catching COVID. So here's some more national rankings, and then we're going to bring in Dr. Toyin to have a discussion about this. National rankings in terms of the percentage of the population that is fully vaccinated. Alabama ranks 51 out of 52 states. And so I know there's not 52 states, so don't check my math on that one. But they include DC and Puerto Rico in that statistics. Is how we got to 52 instead of just 50. Also, in terms of hospital admissions, Alabama ranks 24th out of 52, so right in the middle of the pack when in regards to people being admitted. And these are statistics based on the end of May of this year. So this is not total. This is based on the end of May of this year. And then finally, new deaths. 19 out of 52 of the new deaths that are being reported related to COVID are coming out of the Alabama ranks 19th. With regards to new deaths. So that's the real deal when it comes to Alabama and statistics with regards to COVID. So, all right, so that's the big picture. Those are the numbers. So let's have some conversation about why that is and what we can do to help people stay safe and get healthy. So my first guest is not a stranger to Black doctor. She is Dr. Toyin Imwafo, and we like to call her Dr. Toyin. And she is one of the first. She was actually the first doctor that we had. She is a infectious disease specialist, And she is the first doctor that we had on Facebook Live way back in March of 2020 when we first started learning about the coronavirus. And so she has been with us throughout this process, and she is part of the reason why Black Doctor has become one of the most trusted sources, especially among Black Americans, with regards to getting their vaccine information from. So I'm going to bring on Dr. Toyin here. Good evening, Dr. Toyin. How are you?
Good evening, Ellis. Good to be here again, and thank you for having me.
Absolutely. I forgot to mention that Dr. Toyin also is on Black Doctor every other Saturday.
Yes.
She's got a program called Health and Wellness 360 with Tifal and Chi.
Yes.
And with her and her husband do a wonderful, wonderful program every other Saturday. So check that out. It's at 9 a.m. Central Time. So you can check that out as well. So a little shameless plug for your show there.
Thank you, Ellis, our producer on Health and Wellness 360, for shouting us out. So thank you so much for having me.
Okay, so first question is, when you heard those numbers talking about what's happening in Alabama, what were your first thoughts?
What were my first thoughts? The good thing is that we have the rankings and we're able to track the data. And my first thoughts are, what do we need to do to get those numbers up? And unfortunately, for other outcomes that we look at in terms of disparities in other things, including HIV testing, mortality from other conditions, we do see that the southern part of the country, we do see larger disparities when we track in terms of health outcomes for diabetes, obesity, HIV. So again, I was not terribly surprised, but my first thought is, what do we need to do? And I'm glad you're doing this kind of program to have a diverse panel of how do we use those numbers to figure out how we get to where we need to get to, because that is much lower than other parts of the country. Yes.
Absolutely. So what do you think is preventing the southern states? Is it a political reasoning, or is it that we just haven't gotten the right messaging in terms of people don't trust the vaccine because of maybe who they feel is responsible for creating it? What do you think is factoring into that slow acceptance rate by the southern states?
Ellis, I think you pretty much nailed it. So you said, how much of that is political, and I'm not going to get into that. But Absolutely. In terms of that, in terms of the politics of what's going on around even before the vaccine, in terms of, mask wearing, we saw differences. We see that when we don't have a national mandate and states do different things, there's always issues with that. We also know that there's a lot of local misinformation in different parts and where people are accessing the information. So it's probably a combination of those things. And also then saying, well, what is happening around me? And a lot of it has to do with information. So if, like you said, if 1 out of 5 people are vaccinated, if people talk to the people around them, no one's vaccinated, that seems to be the norm where you are. So I think it's a combination of a whole bunch of different things in terms of there was, changes in policies initially around different things around mask wearing, in terms of a national mandate, and then just looking at the different politics in the different areas, and just also access to information and where people are getting the information from. So it's really important for shows like yours that also have not just people coming nationally, but people from those communities and healthcare providers from those places to be able to talk about what they're seeing and how we can get those numbers up. So it's good to have the data, and I'm glad that it's collected, but it's always a starting point to how do we do better? Not looking back, how do we go forward?
Right. I think you just summed it up perfectly. We're trying to do better. We're trying to figure out how to improve the conversations. And again, a vaccine decision is personal, right? What we're trying to do is provide the proper information to try to, overcome some of the misinformation and some of the doubts that people are having. So one of the main things is I've already seen a comment tonight, is like, people are not trusting the safety of the vaccine. So what can you tell people about the vaccines? Even though we've had 300+ million doses have been administered around the nation, people are still iffy when it comes to thinking that the vaccine is safe. So how can you help people feel more safe if they're thinking about taking the vaccine?
Right. Thank you so much, Ellis. And it's interesting because every time I come on, I have more numbers to talk about, like this many people. So I remember, when, we got the EUA approvals for expanded, the emergency use authorization in December for the Pfizer and Moderna vaccines, what we had was clinical trials of 70,000 people. And trust us, based on 70,000 people, it's safe. And then we get to a couple of months later, there's millions of people. And now, like you said, 300 million plus doses, more than 170 million people have had vaccines, fully vaccinated, 50% of the population. So again, the numbers are there. We have the information being collected around safety outcomes. We know all of that. But I do think that at this point, there are lots of reasons, right, why some people are still holding out. Some people actually don't know that there is access and that you can get it regardless of ability to pay. It's free. They don't know where to get it. It's an access thing. For some people, it's still a trust thing. And that's where you have to have that discussion that at 300 million, like, what would be a number that would make you feel comfortable? Is it if somebody you knew personally took it? Is it if somebody you trusted took it? So we now have to delve into because it's now not a numbers game. I mean, that's like half of the US population. Right. And we have to say, but if within your own network, nobody has taken it, 300 million means nothing because the people you trust and care about haven't taken it. So we need to delve into what is it that what you're worried about. Some of the things people are worried about is the tracking thing. There is no tracking. There's a lot number on vaccines and there's a safety number because you have to make sure they haven't expired. And like every medication, there's a lot number, but there is no tracker that goes into you. People worry about, does it alter my DNA? It does not. The mRNA vaccines, which are the Pfizer and the Moderna, or the Johnson & Johnson, which is a vector vaccine, do not enter into your DNA and do not alter your DNA. People worry about fertility. These are vaccines primed to produce antibodies against the spike protein. They don't go into your chromosomes. They don't go into the male or female reproductive organs. So when people say safety, it's at this point at 300 million, it's not really a numbers thing. But it could be a numbers because within their network, nobody they know has gotten vaccinated. And then trying to figure out what is it you're worried about, specifically about safety. Is it the very few allergic reactions? Well, we're monitoring you for 15 to 30 minutes after the vaccine, and those allergic reactions are treatable right there. Is it the fertility issue? We explained that. Is it the DNA? No, it doesn't enter the DNA. So it allows us to have a conversation if it's a safety issue. If it's a trust issue, it becomes what you're doing on Black Doctor, having trusted people from the community do the messaging and show by example that they got the vaccine. So I think at this point, it's really trying to figure out what exactly people's concerns are, knowing that best case scenario, there will still be people who will never get vaccinated. But I think we have a lot more room to go.
Absolutely. I completely agree with that. I think you made a really good point when you're talking about the trust in terms of how because there are many, you're right, there's many different reasons why people are kind of still vaccine hesitant or vaccine skeptical. But a lot of that kind of trust, I think, is woven in one of those things, and say, okay, do I trust how it was manufactured? Do I trust the people that pushed it? Do I trust the people that are giving me the initial information? Do I trust my friends and families? And so I think we do have to realize there's some trust in there. And we've got to do what we need to do, have these type of forums to continue to overcome that. So I want to talk briefly, because you're an infectious disease doctor. Could you explain like how vaccines work? What are the roles do they play? I know when people think they're getting the shot, that it's going to stay in their system. How do vaccines work, and how does this particular vaccine, either side, whether it's the mRNA or the Johnson, how do these vaccines work?
Thank you, Ellis, for that question. So vaccines work to really prime our bodies and produce antibodies so that when you are exposed to whatever that condition is, your body is primed to fight it and to get rid of it. So we've had vaccines for everything, right? For flu shots, for hepatitis, all our childhood vaccines, measles, mumps, rubella. What they do is to prime your body so that you have antibodies, so that when you get that exposed to whatever that pathogen is, bacteria or virus, that your body is able to deal with it. So for the mRNA vaccines, what the vaccines do is they deliver the message to our cells to make that spike protein, which we've all heard about. That's the part of the COVID virus that it uses to attach to cells. But what the mRNA vaccines do is have our bodies make this harmless spike protein, similar to something the virus had. So when your body sees that, your body says, this shouldn't be here. It makes antibodies to that. So that if you do get exposed to somebody with COVID, or you come in contact with someone with COVID, your body already has antibodies to fight that off. So that's what vaccines do. They prime your body to make antibodies to fight off something when you actually get exposed to the real thing. So both the mRNA vaccines and the vector vaccine, which is the Johnson & Johnson, what it does is have your body make antibodies. The actual products to sell, the mRNA vaccine, they're degraded. They're degraded and broken down by your cells and expelled within a couple of days. So that it doesn't stay in your system. What happens is your body continues to make antibodies so that if you do get exposed to somebody with COVID, you don't get infected because you have antibodies to block that.
I think you're making a good point, because I think when people are saying, well, what are the long-term effects? And you just said basically something really important, that it doesn't stay in your body. So it's hard to have long-term effects of a vaccine that's not going to stay in your system. The only time you have long-term effects, and we'll talk about this a little bit later on, is the opposite side of that is there's a long-term effect that comes that's happening more from COVID that we haven't heard. That from COVID itself than coming from the vaccine. And so I think that's a really good point that you're making in terms of how vaccines work. We're just teaching our body. We're giving our body the exam questions before we have to take the test. And hopefully we don't have to take the test, because that means we've been exposed to COVID. But now you've got the answers ahead of time. Your body's prepared for it. And so therefore that reduces the severe reaction, which is death. Right. And so that's what the vaccine is there to actually prevent. So,
and that's why I think sometimes sometimes people with some of the local side effects, or some of those side effects they get, especially with the second shot of the 2-shot vaccines, is that your body now, that second time in 3 weeks or 4 weeks, is already recognizing spike proteins, right? So when you do this a second time, there's more of an immune reaction to that, getting your body primed for the real infection.
So there's an interesting question in terms of, do we know as of right now if we're going to have to get a booster shot at some point, or is that something that we're still kind of getting the data back to see if we can kind of curb some of these variants? I mean, there's a lot of factors that come into this, but it gets too complicated. Make it simple for us, like for us that sat in the back of the classroom that didn't get the FD like you did.
No, that is, there's some, like you said, there's some vaccines we know we need to get boosters for, right? Remember the tetanus, they tell you every 10 years you need to get a booster. There's certain things they say just before college you need to get a booster. For this virus, and because of how it is a coronavirus, what we know is that there's still a lot of work going on, but there is a likelihood, right, more than likely, that this will become something that we have to get often. Is it going to be every season? Is it going to be every 18 months? We don't know that yet. But we do know that based on how coronaviruses are and the antibodies, what we know is that depending on how long the antibodies stay in your system is how long the protection is, right? So things like tetanus vaccines, we know the antibodies are there for a long time, because those are coming from what we call cell-mediated immunity. Those are secondary type immunity, not just the regular antibodies, but memory antibodies that your cells are programmed to remember. For this COVID vaccine, we know there is some regular antibody production from what we call a B cell, but we also have some cell-mediated antibodies that are already being produced. The question is, how long do they stay? So all of those people in all these clinical trials, they're being followed up in terms of getting their blood drawn to start measuring antibody levels. They will be the first clue, because they got vaccinated before the rest of us, right? The 77,000 before December. They already have time now where they're looking to see when that antibody level drops enough where we could be potentially at risk again. And that will happen. Once we know that, it will become one of the things we'll know about when we need to get boosters, how often we need to get vaccinated against this. But it'll be a little different because we won't be completely naive to COVID-19, right?
Right.
This circulating, it hit us all, everybody, you know. So again, there will be some level of protection even as we go into the next season.
So last question, because we've got some other guests I got to get to, but last question for
Okay.
you is that now that we know that the Pfizer and Moderna vaccines have been approved for children as young as age 12,
Well,
what impact do you think that's going to have on the overall health? Do you think that parents will feel more comfortable, or do you think there'll be more questions now that they're talking about bringing in middle school age kids and getting them vaccinated, even though they're used to getting vaccinated? This is a different type. And so what impact do you think that taking it down to age 12 will have?
I think it's going to have a tremendous impact on getting us to that 70% herd immunity, where it's harder now for the virus to find another host, because this virus needs person-to-person transmission. So the herd immunity is when you have 70% of the population at least vaccinated, it becomes harder to find that person who is not. So I think the fact that 300 million doses now we can give it to kids gives a lot of comfort, because it takes a lot for the College of Pediatrics and all the researchers to be able to go down to 12 years. That means that the science is there, the data are there, the safety signals, because we're talking about kids in puberty and all this stuff. I think it will make some people more comfortable. Like you said, we're used to childhood vaccinations. For some people, it may be a chance to go with their kid. Like, okay, now we'll do it together because there's 300 million people. It's also an informed decision, a discussion within the family. Do we want to do it? If the parents are already vaccinated, they're probably more likely to take their children in. And some people have said, well, kids don't really get sick from it. They don't have a lot of problems with it, but they can transmit it, right? So just for the safety of other people, it's important to get the children vaccinated, and also know that we can't predict who's going to get this long-term COVID. 20% of people get some of these complications. We've seen heart myocarditis or cardiac involvement with young people. So it's important to protect them in terms of also spreading the infection. And I think for some people, if it's good enough all the way to 12, may engage some more adults, and we can get that 29% up to a much higher number in Alabama.
Absolutely. Well, thank you for that. Stick around, because we're going to have some Q&A at the end. So we'd like to have you back so you can kind of talk about a little bit more about that long haulers, because I think that's something that's really important that people don't think about when it comes to catching COVID and surviving COVID. So thank you. And Dr. Toyin brings up a really good point in terms of children, right? So we're going to bring on our next guest. We've got Andre Pinkston, who is an Alabama resident. He is also a school teacher, and he is a restaurant owner. And so he has a very unique perspective, and I'm gonna let him tell the rest of his story. So we're gonna bring him on, and we're also gonna bring on Robert H. Turner Jr. He is also an Alabama native there. He is, Robert, you are an attorney, or you are a judge, or you both?
Actually, I am an attorney, a general practice attorney. I practice primarily with criminal law. Then I am a part-time child support referee. So it's an adjunct judge position. It's twice a month where I hear and decide child support cases. And then I'm a pastor of my home church. Actually, I'm a pastor at a Missionary Baptist Church here in Alabama.
Amen, amen. So, Andre, I don't want to give you what school you teach at. I want people coming up to your school. So you can name your restaurant if you want people to come by your restaurant there in Montgomery.
Vibe Restaurant in Montgomery, Alabama.
Vibe Restaurant?
Yes.
Okay. And so what I hear, you mean on the grill, from what I understand.
That's what they say.
So, Andre, we'll start with you. What made you make the decision to get vaccinated?
Well, I teach 8th grade math and honors algebra. So my range is, my students are 12 to about 15 years of age. And when we got off of Thanksgiving, I told a lot of my students, I said, you need to be careful. And a lot of them told me that, hey, we're going here, we're going this, and what have you. And so when we came back from Thanksgiving, we had been back maybe about a little bit over a week. And I had two of my students come in on consecutive days. It was a Wednesday and a Thursday. And the young men told me, Mr. Pinkston, I'm really worried. I don't know what's going on with my younger sibling. And they were kind of, describing what was going on. And I said, hey, that sounds like they may have COVID. And they said, well, we don't know, but my mom, my father, they're going to take them, to the doctor. So I told them, I said, well, we have passed something here in Montgomery that said, well, if a sibling or somebody you've come in contact with may have COVID, you can stay out. So I told my students, I said, hey, until you find out, you all stay away and stay out, just so we can find out what's going on. But it happened on a Wednesday and a Thursday. Well, that week, that same weekend, I went out and I kind of felt a little funny, but that Monday when I went to work, I would say I was at work for maybe 3 hours. And all of a sudden, I don't know what happened, but it hit me. And because of my medical history, I had a rare form of aggressive lymphoma. My immune system had been compromised. And so I knew with any kind of illness like that, I knew something was wrong. So I spoke with my administrator and actually we had a wellness team in, and they actually came in and they took my vitals and all that. And I said, well, I'm going to go to the doctor. And when I got to the doctor, they told me that, hey, you have COVID. Now at my school, I was the first to get COVID. No other employee had it. With me, because on that day I had come in contact with quite a few people. They sent all those homes, and of course they had to be quarantined or what have you. But now, the big thing about it for me was I at first was reluctant to take the vaccine when it came around, when they said, well, teachers can take it, because I thought, and this was after I had already had COVID now, but when it came around where they allowed educators to take it, you know what I actually thought? I thought they were putting COVID in you.
Okay.
Like they do with the snake bite, they use the venom of that, so that's what I thought. But my primary physician told me, he said, well, hey, first off, you check off on so many lists because of your immune system and you're asthmatic and things of that nature. You can go and take it, and hey, and it would be best for you to take it. And I'll say this, what I went through when I had COVID, as I told you, Ellis, earlier, those 9 to 10 weeks, I felt at times like I did when I had cancer. I felt at times, of course, when I had asthma attacks. So I had it really rough. And so when he said that I could take the actual vaccine, I ran and got it. And actually the day that I went in for the test, to actually take the vaccine, I had just cleared the hurdle of the amount of days that you have to have.
Right.
I had just cleared it by one day. And I didn't know anything about that. And so I was worried. I was like, I'm not going to be able to take it. I'm not going to be able to take it. I know I need it, but having taken it, I remember when I came out and I heard the doctor earlier talking about the time that they monitor you. That's what they do. They had me moving my arm around, up and down, back and forth to make sure, I guess that the vaccine was moving, or actually maybe to keep my muscle or something from tightening up. And so for me, that was it.
Right.
You know, now I can say this honestly, because I had COVID so bad, that night I felt kind of uneasy, and they told me later, because I had COVID in the way I had it, and they looked back at my files and said, well, that was just something that, you know, because you had it and you had it so bad for 24 hours, I felt not like I did now when I had actual COVID. I just had this uneasy feeling. After that, I was fine.
That's what's up. Mr. Turner, what prompted you to get vaccinated?
One of the things that happened with me was Alabama being a conservative state that it is, with the politics being as it is. Our governor declared that attorneys were essential personnel. Okay. So we were one of the states where, being that we were deemed to be essential personnel, we still were having court to a large degree, you know, even though some judges modified and allowed us to have virtual sessions, it still required us to come in close contact with our clients. You can't go into court, even if it's virtual, without having contact with your clients. So being that I was going to still be in contact with my clients, I felt like it was important for me to be vaccinated at the earliest possible time. So I chose to be vaccinated. The other thing is, there are several close family members of mine who have some immune diseases. And being that I was still going to work pretty much every day, I felt like it was important for me to be vaccinated, because I didn't want to endanger other people, or in the event that something happened to somebody that I was close to, I didn't want to be in a position where I couldn't render proper assistance to them. Then the other thing, the real kicker was, you have to always, I think it's important for us to be well read and to follow the news. There were a number of people in our community that contracted COVID. We're not a big county. I'm representing the rural parts of Alabama, but so in rural counties, actually, if you lose 25 to 30 people, that's a big number when you look at the percentage of our population. And there were so many clients and so many people that were relatives of clients, and so many churches that were hit hard by COVID, that I felt like it would be a good idea for somebody who is known in the community to say, I'm taking it. I know that there are a lot of myths. I know that there's a lot of misunderstanding out there. So I felt like it was really important for me to take it. I announced it to my church, encouraged all of the members of our church to be vaccinated. And we had a really, really good success rate amongst our congregation of people that were able to go out and get the vaccine.
Speaking of your church, are you back? I know Alabama opened up quickly and they said, hey, we can have full capacity. Have you gone back to, I know you were doing virtual for a while. I've caught some of your services. So are you back in church, or are you still doing virtual?
Our church is still conducting services virtually.
Okay.
And the reasons for it are that Alabama, and I think you all read the statistics out earlier, Alabama is one of those states where we aren't afraid of much. And we as a state have opened up almost completely. A couple of, I think it's probably been a little over a month. You know, football's big here, Alabama, Auburn. I happened to be in Tuscaloosa the weekend, and Alabama had its A-Day game. They had over 40,000 people at the A-Day game. And I didn't attend, but I was in town that day. And when I saw the number of people that were unmasked, every restaurant that we attempted to go to, the indoor, outdoor seating, all of the patios were filled with people. The restaurants were filled and people were unmasked. And one of the reasons why we've elected to remain virtual is because the state has opened up so fast that I don't think we're completely out of the woods. You know, and it only takes a couple of people to be infected and to spread it, and we're right back at square one. So, but for the safety of our congregation, I don't want to be the pastor that's in the news saying they went back. And so many people have become sick again. So that's my personal story, my personal reason.
Andre, question.
Yes.
Did it make you feel more comfortable when they opened it up to children? Because you teach middle school age, 12 to 15. Did that make you feel more comfortable that thinking that hopefully maybe some of your student body would go get vaccinated before they return to school in the fall?
Well, I have such a relationship with my students, and we talked about it.
Okay.
We actually talked about it, and I explained. See, I guess me having had COVID, and they know I had the actual vaccine, and they actually know because, like I've said before, my students, I'm really open with them, and so I told them if they asked me any question, they asked me how I felt, I told them, and I guess in a way that kind of may have scared them because they didn't want to have to go through that. So if we found out, and I actually told them, I said, now this summer, you, and I know it's a decision is between you and your parents, but you all can take the vaccine. And my thing about that was some of my students, now, like I say, when I caught it, the young men, I don't know if they had it, but like I say, their siblings had it, and then I eventually got it. But some of my students actually got COVID later. And the effect on them, really, it was difficult this year for them academically.
Right.
And so I have told them, I say, hey, guys, look, if they say it's safe and you see your teacher, Mr. Pinkston, right here, hey, go ahead, and if your parents and you all have talked about it, I know now some of my young ladies told me, Mr. Pinkston, one day I want to have a family. Now they did, those young girls, my 14-year-old young ladies, they said, well, I'm afraid to do it because they say, and I always tell them about they get me, they say that they
it caused all the trouble on the planet. They
and they. D said or they. I said, listen. I said, think about it. If I thought like that, think about Mr. Pinkston, where I would be, because having had COVID and then coming back in a situation where so many students ended up with it, I said, I want to be here for you all, but I had to protect myself. And all I'm asking is, you all say, hey, you're crazy about Ms. Pinkston, and you say that you want to do this and what have you. Well, when you come back, because I have some students that will be coming back to me this year, I say, hey, you want to look out for Mr. Pinkston? You want to do something for me? Hey, if your parents say you can, and I say it doesn't hurt, go ahead. I mean, and hey, listen, you'll be safe, I'll be safe, and then we can continue on back to normal. Now, I want to say something too. I was listening to Mr. Turner, at the restaurant. Now, my big thing about that at our restaurant is we shut it down, but see, we never went down to half capacity. After me being sick, we went down to 25%.
Okay.
And we just got rid of you. I mean, unless you was going to stand up or do something, you couldn't, there's nowhere to sit.
Right.
And so I have really been on, and you can't come in our doors, even to now, right now, even though the state is opening back up, you're not allowed in that restaurant without a mask on.
Gotcha.
Now they come in there and don't have them, we have them for them. Okay. And our staff wears masks, and I was listening to what Mr. Turner said, around the neighborhood and all of the little small convenience stores, the gas stations, he's right. I'm the only one in there with a mask on. The only one. There have been times, Ellis, that I've gone into places and got to the door and turned around, got in my car and just drove off. It was just too many people, even with a mask on. I said, I can't fight all that. There's too much going on in there.
I got you. I got you on that one. I feel the same thing. I'm in Georgia, and it's very, very similar here. So we've got a couple more people we want to get to, and we'll get back to. So I'm going to ask y'all to hang around. and we're going to come back and we're going to talk about it. I want to ask you, Andre, as you think about this for later on, is are there any lingering symptoms that you're having from having gone through COVID? And so we want to kind of talk about that, because I know people talk so much about the vaccine, but we don't talk about what it means to have caught COVID and what that means in terms of your health going forward. So we'll talk about that later on. So we're going to continue down this path. We're going to bring on Bishop Jim Lowe, and he is another person that's not a stranger to Black Doctor. He has been on our program before. We did something in the fall when the vaccine was first rolling out, and we did a program, and we had on Bishop Lowe, and Bishop Lowe shared his story. So we want to get an update. So just the quick and dirty was Bishop Lowe also contracted COVID. And it took him out too. He could tell that story better than I can. But we're going to talk about. But he's here, so obviously he was able to survive it. But we're going to talk about his church, what's he got going on there, and talk about how he's feeling now in terms of his vaccine. Welcome, Bishop Lowe. You're on mute. What happened? Did we lose? I think Bishop Lowe hit the wrong button. So we're going to get it. Happens. It happens.
No.
There it is.
Yeah, I'm sorry. I'm looking at the wrong thing here.
You hit the wrong button, Bishop.
I sure did. Yeah. I don't know where we'll start here. I did. I spent 10 days in the hospital with COVID, and I wasn't aware of the fact that I had it. At first, I was not, except I was having difficulty breathing. And I went from a Saturday to a Monday, having a hard time breathing. And my wife said, I think we need to take you on into the emergency room again. The first day I went out, they didn't test me for COVID.
Okay.
That was on a Saturday. And because I was having problems with hiccups, which is something I do have a long-term problem with anyway, is hiccups. Right. But I was thinking I was having hiccups, and in between my hiccups, I was having difficulty breathing. So we went to the emergency room on a Saturday. They gave me something to calm me down and everything, thinking that was going to stop hiccups, because hiccups would come up and then I couldn't breathe. So I went through Sunday. I didn't go to church that Sunday. My son carried on in my stead. And then on Monday morning, my wife said, we just need to go back to the emergency room again. We went back. They tested me for COVID. You got COVID. You're going to the hospital today. About 5 o'clock that evening, I went to the hospital. They gave me oxygen and everything. They said I had double pneumonia. COVID had brought that on. And so from that Monday, for the next 10 days, I was under hospital care. Biggest scare came the middle of the week when they were, because I said I had problems with hiccups. I found out I could hold my breath, and if I'd hold my breath, then it'd make my hiccups go away. But it also lowered my oxygen content. And about the time I was holding my breath, then a respiratory therapist came in the room to check me. And when they came to check me, my oxygen content was like down in the 80s. And they just went ballistic. They were talking about intubating me. They were talking about, we're going to have to do something. And they came in, and there's this, they can, I'm sure the doctor can tell you, they do something right in the artery right here. And they stuck in there to try to do that. And it was a very painful thing. But I spent those 10 days. I made it through. We did remdesivir treatment and various other things. And I didn't realize the severity of what, I didn't have any other difficult times with it. Maybe we caught it early. But when I got out, I started hearing about some of my friends, some that had COVID, went to the hospital, never came back. I started hearing about deaths that were happening, principally among us as African Americans. Other people have no problem with it. I think I contracted it from my son-in-law and my daughter, who both had it, who never were not hospitalized, but hey, they're in their 30s. At the time I was 68 years old, so still 68 now, but that's when it occurred. So I'm an older person, more prone to it. I had another brother who was in his 50s. He died from it. Then I hear of other people younger than me. And it's something about COVID with African Americans. I know you all have discussed it. That when we get it, is a greater severity on us. We experience more serious illness than people of color do. So when it came down to now, when the vaccines came through, recognizing this, I got before my congregation, said the vaccine's coming, they're gonna make it available for me. I'm gonna do it. I'm gonna get all the elders of the church. We're all going to do it because we recognize this one thing: COVID can kill you. So we're not going to play with this thing. Well, some people say, but you don't know what's going to be the long-term effects of the vaccine. No, we don't know what the long-term effects of the vaccine will be, but we know what the short-term effects of COVID can be, especially on African Americans. And that short-term effect can be death. So why do we want to risk this thing? And then the second thing I told them, there's a scripture that says, and these signs shall follow those that believe in his name. And it says they shall lay hands on the sick, various other things that they say there, cast out demons, speak with new tongues. But then it also said, if they drink any deadly poison, it shall not harm them. And from that, I said, for people of faith, let us recognize we will do what we need to do in order to do the right thing. We have to trust the system. We will do it. But where the system might fail us, we know the word of God's not going to fail us. If we drink any deadly thing. And I said, that will be the scripture for this congregation to stand on. That if they give you the vaccine, you trust in God. You've done what you think should be done. You've listened to the authority, like listen to what the doctor said to you. So therefore, we're going to take the vaccine. I'll be one of the first ones to do it. All the elders are going to do it. And I encourage everybody else to do it because once again, no, we don't know what the effects of the vaccine will be long term. But for us as African Americans, COVID can kill you. And I don't want none of y'all going out with COVID. So we're going to take the vaccine and we're going to trust God for the rest.
Amen for that. Let's talk about your congregation. Have you asked Brother Turner, and they haven't opened back up, do you have some capacity at your church? Are you doing some security measures if you have people there in church? Because I know, look, I've been black my whole life. And so we like to.
I think I have too. Yeah.
We like to worship together. You know what I'm saying? And I know virtual church has been hard for many people, especially the more senior members of the congregation. They like to come in and sit in their spot in the pews. And so have you opened back up now that your state has? Have you opened back up in terms of your?
Actually, I have a large assembly area. We've got 1,500 seats. And with my congregation, we were having services. We started services, I think it was maybe the last week in May of 2019. I said, now we're going to come back. I said, I won't go against what I see what scripture says here. It doesn't matter. The scripture says, forsake not the assembling of yourselves together. So therefore, my job is to figure out how I can keep us together. With 1,500 seats, then we're going to take a sample of people, and we will get at least no more than 150. We can space you 10 chairs apart, and we're going to let you come back, and we'll set it up so that different people can come back to church at the same at different times. We started doing that when I got COVID in July, 1st of July last year. The elders felt like, well, we need to shut church down. I think they shut it down for like maybe 3 weeks. When I got back out, I said, no, we're not violating scripture. We got a church. God has blessed us with it. We are going to, we're going to have services. Now, we're going to practice safe service, if you would.
Right.
And I said, so we're going to require everybody to wear a facial mask. We're going to set our congregation out. So these are certain seats you can sit in. Everybody will be required to wear a mask. Everyone's going to have their temperature taken before they come in. We're going to ask them if you have any sickness, anything. So don't come to church. I restricted people like my mother, who's 93 years old, and those that were that had different health factors. That I said, you're not welcomed. And now these are some of the seniors. I said, you're not welcome. But some say, well, Bishop, but we want to honor God. I said, yeah, I'm going to let you honor God. but you're not welcome to come to church at this time.
Right.
And we started streaming. We did that, and we streamed, and we've continued to do that. But right now, I probably have got, we're filling up the auditorium at this point.
Okay.
But again, we're practicing safe service.
Right.
And
Right.
everybody's got to wear a mask. Just talking about wearing a mask. I mean, I've got several. I mean, you got one right here that. So I come from church, and even the staff has to wear the mask. But probably at the end of this month, I'm going to. I'll probably take that requirement out.
Okay.
But we're going to see what's going to happen first.
Right. Right. And I think it's good to have that contract. So people have to work, and I think having a safe service approach is the best way to do it. I love the way you have blended scripture with the secular world, and able to marry the two in a way that fits your congregation and your faith, as well as what's going on in the world.
Well, basically, I have a problem. My problem is I see what the scripture says, and I believe what the scripture says. Mm-hmm. And I believe that I do believe we wrestle not with all these physical things that are out here, but spiritual things. That we have to understand that God has a plan. God has something He wants to do, and I do believe that the church is under attack in these last days. I believe that this issue with COVID and the shutting down of churches is part of the plan, and we can find out, and we see very clearly now that a lot of people are not coming back to church, period. Right. What's it take? 21 times to make a habit or something? Well, people have been out of church for at least 21 Sundays. And we will probably see that a lot of folk are going to take the attitude, hey, I can watch it on stream, I can stream, and I can do that. But that's not what God said. We need that fellowship. We've got the fellowship. I felt like the responsibility of me as a pastor is to assure, not saying anything about anybody else, but, each one is called to do what God tells them to do. And I said, I am not going to be the reason folk are going to stop coming to church. I'm not going to help them to stop. And I said to everybody else, you pray, you decide. We're going to take every method we can to be cautious. And when vaccine came out, we're taking the vaccine. I'm doing everything. We're listening to what the government's saying. I said, y'all got to understand what you see on the media and everything. A lot of that stuff is lies. You're not knowing the truth. But Jesus said that if you abide in His word, stay with Him, He will then reveal to you the truth, and that truth will make you free. So hence, I'm a little bit stupid with stuff goes on in the world. If the Bible said it, I don't care what nobody else say.
I hear you, man. Walk by faith and not by sight. So I do appreciate that with you, Bishop Lowe. So hang around. We got a couple more interviews we're going to do. We're going to do a wrap-up session here at the end of the program. So thank you for sharing that with us. And like I said, stick around. We'll talk to you in a short time. Yeah. So next we're going to bring up is Dr. Lindsay Harris. And I mentioned this at the top of the program. This is not only the president of the Alabama Nurses Association. Why that's significant? Because she is in the 107-year history of the Alabama Nursing Association. She is the first Black president. So I'm going to give you some props for that in terms of being a pioneer, Dr. Harris. It is amazing. Thank you for joining us this evening. Thank you for everything that you're doing and for standing in the gap, because I know that is a tough position to have there in the state of Alabama. So welcome to the show.
Thank you so much, Ellis, for having me.
So I guess that's the first question. As the president of the Alabama Nursing Association, you've got Black nurses, you got white nurses. Are you hearing two different messages coming from those two groups when it comes to COVID, vaccine, the whole situation?
No, not really. Here in the state of Alabama, initially, I think that there was a big talk about the hesitancy of people receiving their vaccines, and as well as access. Now we have eliminated the access. We have clinics popping up everywhere, or vaccination sites popping up everywhere. And so as far as the nurses concerned, there's not really any difference. I mean, they treat everybody on every different end of the spectrum. So we're hearing the same thing. It's you have that set of population that will not get the vaccine, and then you have those that have still questions about it, and those who are willing.
What are some of the main questions, the questions that you hear repeated over and over again when people are asking when they're talking to your nursing body? What are they saying to you?
I mean, much of what has already been said. Some of those myths of, fertility. So
right.
Is it going to affect my fertility? I've even had questions at the hospital of, I've gotten fillers in my face. So will it affect the fillers that I have? I mean, you would be surprised, or you probably wouldn't be surprised. But just much of the same myths that we've been hearing and that Dr. Tonin spoke to earlier today or earlier.
Absolutely. So what about you? Are the nurses, what do you know the percentage of nurses that have been vaccinated that are part of the organization, or do you all keep those records?
No, so we wouldn't have those records. That would be, with the hospitals and at the state level. The Alabama State Nurses Association, we did perform a survey last year in March, as well as this year as well. And our survey was just how we wanted to address the pulse of the nurses. What is going on within nursing? And it was, I mean, the results that we had were just astonishing. I mean, it was, nurses are tired, nurses are working, so many hours just with the COVID patients. And, when we ask about, we didn't necessarily ask about vaccines initially, but, nurses are still educating patients about vaccines and encouraging them to receive the vaccines. The state organization, we actually had vaccine experts to come to every nursing district and educate them on vaccines. So when patients were to ask about vaccines or want to be more educated, we were educated ourselves.
Well, absolutely. That is wonderful. That is a great thing to have in terms of, but you're absolutely right. And one of the things that we have been learning when we're talking to, because we've talked to a lot of experts and a lot of doctors, but when we start talking to nurses, they seem to be the ones that are most affected because they're treating the patients that are coming in. They're treating when Bishop Lowe goes in, they see the doctor a couple of times, but they see nurses all day, every day. The nurses are doing the checks. And so that has been a drain on the profession with regards to how many people are being hospitalized, especially initially when COVID first hit. And so have y'all done anything in terms of like mental health, in terms of job fatigue, things of that nature?
Actually, we have created a program. It's called Nurse to Nurse. So the Nurse to Nurse program gives the opportunity for our nurses to come in, and it's a peer-to-peer support. So to talk to each other about what they're going through, what is going on in their practice, what questions they may be dealing with or having amongst themselves at work, but also within their families. Within that group, we also have counselors to moderate, counselors and chaplains, just to be there for the support and kind of guide the conversation. So, I mean, it's been a great program thus far. We knew, especially with our survey that we completed, that mental health was definitely an issue. And so at the state organization, we definitely needed to address that. So that's how we addressed it.
Absolutely. So I'm going to bring in Dr. Martha Dawson. She is the president of the National Black Nurses Association. We're going to continue this conversation about nursing. And so I'm going to ask you, while we're bringing on Dr. Dawson, I'm going to ask you this question. When you heard some of the earlier testimonies from Andre and Brother Turner and Bishop Lowe, what were your thoughts when you heard their stories about either why they got vaccinated, or we've had two people that had COVID there on the program tonight?
For me, it was much of like many of the stories that I've heard thus far as to why people have gotten vaccinated. And until, in some families or in some of our citizens here, I could say that until it happens to like them or someone in their family is when they decide to get it.
Right.
which is why we're here today and trying to, educate and inform those who have not gotten it and who have not experienced it, that is definitely something that you don't want to experience. And I'm glad you had those on who have experienced it, because it is definitely a testimony and definitely a benefit for those who just need to hear that.
Dr. Dawson, I know we have talked about this before in terms of, especially when we're talking about those southern states. We had Brother Turner say he's from a rural area, so he knows how devastating just a few deaths in the community can have on his community. But also he felt like he needed to speak up as a member of that community. So when people come in from out of the area, out of the county, out of the district, and tell you about vaccines, it doesn't have the same impact as it does when somebody that's there, born there, raised there, lived there their whole life says, "Hey, I'm going to get this vaccine," and shares their experience. So I know we wanted to take that approach when we're talking about it, because we can't just bring in all these outside folks telling Alabamians how they're supposed to live their life. So, do you think that this type of forum would be effective in terms of helping get some more people to get vaccinated in Alabama? You're on mute.
Thank you. You put me into a double bind here, because I've been doing a lot of education in Alabama and Birmingham, but at the same time, I've been all over the place nationally as well.
Yes, you have.
And so, but it's always good to have your own to tell their stories. And that is so important in terms of resonating with the community where you reside in and where you live. And so one of the things that I was really listening to from our first three speakers is them telling their journey. And so you had a teacher who's also a restaurant owner, an employer. And then you also had an attorney who is also there with the court system, but at the same time needed to both protect his family. And then we have a pastor that is here that is over a large congregation. So all of those things in terms of people being able to identify with someone, I think is important. And one of the things that I really like that someone mentioned earlier is that people have to begin to inform themselves. And that's what we're trying to do here tonight. We just heard a physician speak first, give you information about the science, tell you about where we've come, what type of research was done and all of those things. So we're trying to get people to move from being hesitant about, taking the vaccine. And when I talk about hesitancy, I also step into that space with them to let them know that I understand some of your fears. There are some historical things around medical research that we have to deal with, especially in the state of Alabama with the Tuskegee incident. I do not dismiss that. I recognize it. I own up with it with my brothers and sisters that are in the healthcare space. But then we want to get you to readiness. And in order to do that, we know we have to step back and also just say to you, we recognize there was a lot of misinformation put out there. And some of your friends and family members and other people might have been doing it not intentionally, because when someone gives you misinformation, what they're doing is they're telling you what they know, but they don't know what they don't know. And that can be confusing. And that's again why we have to have people from the healthcare space to come in and help us to understand these things. Then after that, we want you to move into acceptance. Acceptance then means that you got to first of all dispel the disinformation. Now, disinformation comes from those individuals who know that know that they don't know what they're saying. They know that it's wrong, and they're still saying it. And so we had some of that early on. I won't repeat some of that stuff about the Lysol and all of that, but we heard it, and we know that it was disinformation, not correct at all. And so we as intelligent individuals have to take information from those trusted individuals, whether they be physicians, nurses, pharmacists, your pastors, but listen to those people who have stepped out in that space. I know I had my vaccination. I didn't mind taking it, and I was all geared up for the. Someone said the first part is not going to do so bad, but the second one, it's probably going to kind of take you out. I prepared myself for it. I went Thursday morning to get the vaccination, canceled all my appointment on Thursday and Friday. I'm thinking by Saturday I'll be okay, and Sunday I'll be good. I'm still waiting to feel bad. It did not happen to me. And so we can't just hear what other people say. The reason I'm telling this part of my story is because the way someone else reacts to a medication, it may not necessarily react the same to you. And my sister, she teased me. She said, maybe they gave you water. So when she went to get her, nothing happened to her either. I said, so we both got water. So we're going to be fine. So when we get to that point where we're ready to accept, we have to, I think, both lean in from both the science perspective as well as from the spiritual perspective. But we also have to be concerned about our family members and others. Right. And stepping up and taking action. A lot of people keep saying, but I don't know what is going to happen to me if I take this medication down the road. Well, if you catch COVID, you don't know what's going to happen to you down the road, because we're dealing with this less than 2 years. So we really don't know all of the long-term effects. So we have to prepare ourselves and ask ourselves. So when I start seeing the state in different places just opening up, I'm just like my brothers earlier. I'm wearing my mask and people can look at me funny. I was one of the first ones that started wearing it when it was time for me to do so. And so I still have my hand sanitizer in the car. So as soon as I get back in, I'm cleaning my hands, and I just got some lotion to put on them so that they don't get too dry. But I'm still practicing all of those safe things, because guess what? Washing your hands is good practice anyway. Mom told us to do those things. Yeah. Now, girl, you just came in from outdoors playing. Go in there, wash your hands before you go in that refrigerator. Come on, we're from the South. We've heard these things. You got to have some clean hands, okay? And the other thing is that I don't want to be sick. I want to be as healthy as I can be. And I can't rely on the fact that if I get COVID, that I'm going to recover. Because I think a lot of young people have been misled, because that was another thing when they kept saying, well, older people are being affected more. People heard the older people, they didn't hear the more part. So if they're being affected more, that still means there was some younger people being affected less. Right. But nevertheless, they were catching it. And that's the piece that we have to understand. And I will tell you, I know some people in their 90s that caught COVID, never went to the hospital, and they're doing okay. They're still with us. And then I know some others that was in their 30s, they went there and they did not. Then I know some whole families that almost everyone in the family caught it, and they lost 2 or 3 of their loved ones. Yeah. So those are not this type of history that we want to have. And again, I know I was teasing at the beginning of the show prior to us coming on when I said, there we go again in Alabama. If it's something good, like taking the vaccine, we're at the bottom. That's not good. That's just not good, Alabama. We have to do better. If it's cardiovascular disease, high blood pressure, diabetes, we're at the top. We have to begin to own our own healthcare journey. And I say that it is a journey because it depends on good eating, proper rest, not being under a lot of stress, exercise, and all of those things that are good for us. We have to begin to lean in, own it, and accept it as a part of a lifestyle change, maybe. So it is just something we have to do.
Dr. Harris,
I'm getting older. So, there's some things I can't do and eat the way I used to eat. ice cream on the weekend. I don't even buy it now hardly because I can't handle it the way I did when I was.
I thought my mama was funny when she was growing up, and she was like, oh, I can't eat that. I can't eat that. And I was young, and I was like, oh, you crazy and stuff like that. And she would say to me, she said, boy, just live. She said, just live.
Just
and
keep
sure
on
living. Sure enough, that's some things I can't eat in my life, in my life too. So, Dr. Harris, let me ask you this question: with the state being open, and the data showing that most of the older, in terms of people that are being vaccinated, there's a lot of the older population members that are being vaccinated. Are you seeing younger people come in for treatment now with COVID? Now that a higher percentage of older Alabamans are vaccinated, are you seeing a difference in terms of people that are presenting with COVID symptoms in the hospital? Yeah,
actually we are. I mean, it's not a huge amount, but we're definitely seeing, at one point that was all we were concerned about. Right. Like Dr. Dawson said, the elderly population was the population that were more susceptible to contracting COVID and dying from COVID. But now we're seeing everybody. We've always seen everybody, but now, people, it's more, profound when you see a young person come in that has no comorbidities and that they do not leave the hospital because they passed away. So it's definitely something that we have seen.
Wow. That's a sad condition. So I'm going to bring everybody back. And so before we bring everybody back, as we're getting close to the end of this program tonight, we want to ask the audience, that are the people that are still here that are watching us. So Alexis, you throw that graphic up. We got some questions we want you to ask. We're going to ask you all. And if you want to leave a comment, just put it in the comment section. Just what information was most helpful for you. That's really important, because we like to know. We want to get feedback, because this program is all about answering your questions and helping you get the most information so you can make a vaccine decision. So what speaker resonated with you the most of tonight's people? And did this event help you feel more informed or confident in making a vaccine decision? So you can answer any one or all three of those questions. Put your answer in the comment section. We would greatly appreciate it. So, and then we're going to kind of bring everybody back as we wrap up this program this evening. We'd like to bring everybody, all of the participants back, and we're going to. I know we're pushing over our hour time. I only asked for an hour from y'all, so thank you all for hanging out with us a little bit over an hour. So what we're going to do is we're going to go around. We're going to ask everybody for like a final statement, some thoughts that you may have had after we've seen this entire program. What are some final thoughts or statements that you want to leave with our audience that's watching? We'll start with you, Brother Andre.
Well, I'll say this, and something you asked me earlier, and I heard the bishop when he was speaking about when he had COVID. The thing about me, I ended up having it. It was pretty bad, but being an asthmatic, see, I have my own breathing machine. Mm-hmm. And so when Bishop Lowe was feeling like that, I was treating it also like I had asthma. So I was able to use my breathing machine. And something you said to me earlier, we spoke about, I'll say this. Weeks, and even now, at times, it's not as bad as it was, but my headaches were so intense for so many weeks. Body aches, I still have that. I have a lot of things that I'm still experiencing from having had COVID. Mm-hmm. And so that's one of the things I told my students, I don't know how it would affect you young people, but I know how I am now. And of course, I wouldn't want that on anyone. So that's one of the reasons why I tell all my friends, hey, man, I've gone through it and I know how I feel. Even though I'm better, I still have a whole lot of problems that I deal with, even to this day.
Right. And you bring up a really good point in terms of people don't think about the long-term effects of having COVID. They want to talk about what's the long-term effects of the vaccine, but nobody rarely asks that question, what are long-term effects of having COVID? And there's some significant issues with that. Brother Turner, final thoughts.
One thing I would like to stress to people is in analyzing the gravity of this situation, numbers don't lie. And while I was initially hesitant at being vaccinated, I started looking at how America was faring in this fight against COVID. And when the numbers started creeping up to 100,000, to 200,000, to 300,000, to 400,000, and then we eclipsed 500,000, we were not winning on the fight against COVID. And I felt like we needed to be more aggressive. We need to be more responsible. And it couldn't hurt because we were losing, and we were losing badly. So that was one of the other primary reasons why I chose to be vaccinated. And then I want to say this to people as well. I was one of those people, and I still am. I've only had the flu shot once in my entire life. And the year that I received the flu shot, that was the only year that I ever caught the flu. So, when the COVID vaccine came out, I said, well, I didn't have good luck with the flu shot. It didn't prevent me from getting the flu. But when I started seeing those numbers, and then I started hearing stories about people that I knew. I have a good friend that's a funeral home director. I come in contact with a lot of doctors and nurses and teachers, and I'm so well connected with people that kept telling me this is not over, this is not done, don't play with it. And I agree. I believe them, I trusted them, and I just feel like we have to be more proactive. And I suggest that we do something to be on the offensive as opposed to the defensive against COVID.
Amen. Amen. Bishop Lowe.
Well, I think that on this platform that we have here, it should be a trusted platform. And you're encouraging people to take the vaccine. We take all politics out of it. This platform is talking about us as a people. I think it's very clear that the way this virus affects us as a people, with each one that's here, the virus is nothing to play with. You don't need to play Russian roulette or play a roulette game. If I would take a country out of it and just say, don't play a game with this thing. Like I said, when I began looking back and seeing some friends of mine that were younger, that were dying. I mean, we'd hear about people going in, you'd hear about so-and-so, well, COVID got them. Let's stop playing what all this politics we play. I don't care who said it. The facts about COVID is killing us in a greater degree. Now, and we've discussed the various reasons why, but the facts are still there. The vaccine that we have, no, we don't know, but I don't think they're picking the vaccine out and say, this one's going to the Black community, so we're going to put this vaccine over here. I think we need to start having a little bit of trust and recognize COVID will kill you, but and you don't know what long-term is of a vaccine, but you don't know what long-term is. As my brother was saying, Andre also said, what has happened to him since it. It's just not worth risking what we know is already happening. So I think this is the platform where our people should recognize we got our best interests at heart. Let's start looking out for one another, and let's start trusting one another. I think that we need to encourage people in this program like this. I think it's a very good program to say to our population, the choice really shouldn't be that difficult. COVID will kill you. And a vaccine, maybe it might kill you. You might die from the vaccine 5 years from now, but you might die from the truck that hit you 5 years from now. One thing for certain, COVID will take you out in the next. I've seen people go in the hospital, they got COVID, and they seem to be doing well. The next time you call in there, they're not around anymore. This is nothing to play with. I'll leave it at that.
Absolutely. Dr. Harris.
I'd like to first say thank you, Ellis and blackdoctor.org for this opportunity.
Yes.
I think this is a absolutely great platform with trusted professionals to, dispel the myths on COVID and the vaccine. And, I said this all the time to people that I see in the community, to people in the hospitals, what I want is for people to make well-informed decisions. Dr. Dawson talked about disinformation and misinformation, and I think that it's important that we continue to have opportunities such as these so that people can ask the true questions that they're having in order to dispel the myths and make them feel more comfortable about the vaccines and how we should go on in the future.
Absolutely. Dr. Dawson.
Well, this is a person-to-person conversation tonight. It's about caring and it's about relationships. And we've gathered several individuals here tonight to give you different perspectives. So I want to speak directly to the audience. Is that there comes a time when you have to begin to accept information, look at things through your own lens and not through the lens of others. So for example, when someone is saying that, but I don't know if I take this vaccine, what's going to happen tomorrow? We don't know what tomorrow is going to bring anyway. And the other thing is that we cannot continue to be statistics. We have to begin to say, I'm going to lean towards something that is a little bit safer. So when you say, well, I'll just wait and take my chance with COVID. You don't want to take your chance with COVID, because I'm so glad that they stopped putting this information out. When COVID first started, they used to say X number of people have recovered from COVID. If you notice, that statistic is no longer out there. They usually would say how many have contacted COVID, how many had died, and how many have recovered. And I was one of the earlier ones saying no one has recovered from COVID because they haven't been around long enough for the long-term effects. Mm-hmm. So these things can be going on for years if you catch COVID, And then we have this misnomer again about it being primarily affecting the older adults. One of the reasons was affecting the older adults because for those older adults that was in long-term care facilities and nursing home, guess what? Other people was bringing it in to them because they were already quarantined. Okay, they weren't going anywhere. So we healthcare workers were infecting those individuals. So I'm speaking to my healthcare workers now. If you have not been vaccinated to protect yourself, you need to protect your patients. And we don't need to go into this space thinking, I can play Russian roulette with this. This is not the time to play games. This is the time to be serious, to listen to the science, to listen to those individuals that are speaking to you, and to say, let me do my part. And again, if we have 1 out of 5 Blacks that have not been vaccinated in this state, the next surge, again, we will hear the statistics that Black are succumbing to this virus more than others, and Blacks are also dying. That's not the, how can I put this? That's not the end of the story, people. We don't want that to be the end of the story. We want the story to be that we stepped up, we did the right thing, and we're here for tomorrow. Thank you.
Amen. Dr. Toyin.
Wow, I'm lost for words. And just thank you, Ellis and Black Doctor for getting us all together for this intimate family conversation. Mm-hmm. And I just thank the other panelists. I've learned a great deal just listening to your words and reflecting on your personal experiences, and just the honesty and vulnerability and openness in which we're having this discussion is what people want to hear. And so when we talk about who do people trust and who would be that one person, so hearing about the experience of talking with your students, with your co-workers, with people in your parish, and leadership by example, those are the things that are going to need to happen and need to continue to happen. So it's been a pleasure being. So the 3 things I'm kind of closing with, apart from all the gems and what I learned about on this panel, is the importance of leadership by example and how representation matters, and how when people see somebody telling them, I did this, go ahead and do it. The second is really, what Dr. Dawson said about standing in that place and listening to learn. So when people still have concerns, being able to say, I understand where you're coming from. And yes, there is historical legacy for this. And yes, there are ongoing things right now that continue to widen that gap. But we need to go forward and standing in that way without discounting people's concerns. So how do we make that informed decision to move forward? And the third thing is just, if anything you've heard as an audience member today made you make that decision to get vaccinated, is to take action and just do it. But also remember that your network of 5 or 10 people who all held out, if you finally made that decision to get your vaccine, talk to them about it. Because once people in your circle do, that's how we break into that. So if it resonates with you, there's something about this panel that made you change your mind, and you do, bring the people in your network along. And Dr. Dawson got to close with, as you said, about health and wellness, and really looking outside of just COVID about getting our health and lifestyle and exercise and what we eat to prepare our immune system for whatever comes next. That is beyond that is amazing. That is pretty amazing.
Well, thank you for that. I want to thank all of the panelists that came on tonight, and I think ultimately, one of the things that I say many times is it's important to seek information over affirmation, and what I mean by that is that don't seek something that's just going to affirm what you've already walked into belief. There's a thing called bias, and we all have biases. We have bias about everything, and so we have to make sure when we're talking about health things, we have to check our biases, and we have to seek the proper information, and then let that information drive our decisions. We got to make. That's how we make informed decisions. I'll also say that being born and raised in the South, I understand that we tell stories. And so tonight we wanted to put together a forum where we got those personal stories. We've got 2 people on there that talked about their experience with COVID. So they can share, hey, this is not something that you can say, well, I can live through it. I'm going to continue to play and running the risk of catching COVID. We also have some wonderful experts on tonight that kind of talked about the vaccine. We're going to talk about those messages. We're going to continue to talk about these messages. And so we can get rid of that disinformation and we can continue to make an informed decision for you and your family. All of our panelists tonight, thank you so much for what you're able to do. We're not done yet. Thursday night, we're going to Mississippi. So we're going right through the South. So we hit Alabama first, but we're going to go to Mississippi, and we're going to be in Jackson. We're going to be all over Tunica, wherever you are at in Mississippi. So please stay tuned. If you live in Mississippi, if you know somebody, if you got some family member, I know a lot of Black people got family members in Mississippi, especially if you're from Chicago. So please check us out, and we're going to be talking about what's happening in Mississippi because we really want, this is about safety. This is not about politics. This is about safety. So thank you all for joining us tonight. Make sure you answer the questions we have in the comment section and share this with your friends. If you heard some great information, share this with your friends so they can hear the stories and continue to get the information they need to make that decision. Talk to your friend. If you've been vaccinated, talk to your friends or your family. If they haven't been vaccinated, have a real conversation because they're going to trust you more than anything else, and they can get your information directly to them. So thank you again, and you all have a wonderful evening.
Oh,